presentation on hidden battles, sexual dysfunction, and quality of life challenges in cervical cancer survivorship. So this is my presentation outline. So I'm sorry for disruption. Not the presentation. Sorry for the interruption. So, cervical cancer is the second most common cancer in females in Bangladesh and a very good prognosis if treated properly. But even after being recovered physically, there are multiple hidden emotional and sexual problems remain unaddressed. So, sexual dysfunction is pain, dryness, low libido, and poor arousal is very common in cervical cancer survivor, and it affects the quality of life. And multiple social stigmata and psychosexual care makes this issue highly overlooked. So the primary objective of this study was to identify the magnitude of female sexual dysfunction and its relationship with quality of life. And the secondary objective was to assess the factors associated with the poor sexual dysfunction. It was a cross-sectional study conducted at Radiation Oncology Department of National Institute of Cancer Research and Hospital from June to August upon the cervical cancer patients who have completed their planned course of treatment and were sexually active before treatment. So sample size was calculated using this formula at 95% confidence interval. So the inclusion criteria were cervical cancer patient who had no distant metastasis completed the definitive course of treatment and at least 3 months have been passed and there was no sign of residual or recurrence. The exclusion criteria were patient who underwent unplanned hysterectomy, were sexually inactive before treatment, and widow. So 222 patients were selected by using the inclusion and exclusion criteria. From there, 22 patients withdrew themselves. So final sample size remained 200. So we used two validated Bengali questionnaire. One is Female Sexual Function Index 6 and another is Functional Assessment of Cancer Therapy Journal, that is FACT-J. So FSFI 6 is a tool used to assess the sexual function in women and it used 6 domains. Is desire, arousal, lubrication, satisfaction, pain, and orgasm. And each domain is scored on a range of 0 to 5 and the final score remains 2 to 30. And the FACT-G is a quality of life assessment tool and it has 4 different aspects: physical, social well-being, functional well-being, and emotional well-being. And the total score is 108. And among them, 60 or below denote the poor quality of life. So ethical consideration was considered during our study. Okay, most of the patients in our study were below 50 years and Muslim were the higher proportion of patients. So 52% patient had educational status were SSC or below and most of the patients were in postmenopausal state before treatment. So stage 2 and stage 3 patients were more common and most of the common histology was squamous cell carcinoma and it was 70%. 70% patient had completed their treatment, had interviewed 6 months later. Then they completed their treatment and 30% had interviewed between 3 to 6 months after completion of treatment. And chemoradiation followed by brachytherapy was the most prevalent treatment modality, but few patients also had surgery and few had surgery and radiation. So let's move to the main variable. The mean FSFI score was 11.72, which is far below the lower limit range, that is 19, and lubrication and pain was the most affected domain. So we used a multivariate analysis and it revealed that menopausal status, stage and treatment were mostly affected the female sexual function. And Post patient who were in postmenopausal state before treatment, stage 2, 3, and stage 4, and patient who had surgery and radiation had the most poor sexual function. And this is the mean quality of life score of the patient, and mean quality of overall quality of life score was 50.56. That is poor. That was in poor range. And we did a correlation test to see the correlation between female sexual function and the quality of life. And the test revealed there is a positive correlation between the overall quality of life score and the all different aspects. That means physical well-being, social well-being, functional and emotional well-being. So this is just nothing, just graphical representation of the previous table. And this graph, as I mentioned, there was a positive correlation. So lower the sexual function, lower the quality of life score. And the higher sexual function, the quality of life score was higher. So this is just repetition of the previous slide on different aspects. So we had several limitations because in our study we did not measure the lead toxicity. So this could possibly create a bias in the assessment of quality of life. And there may be some degree of underreporting of sensitive sexual function. And the design was cross-sectional, so it limits the temporal or causal interpretation. So sexual dysfunction is a prevalent but yet often overlooked challenge among cervical cancer survivors, and it significantly affects the quality of life. So incorporating sexual health counseling and survivorship care into the routine oncology practice is essential. And future longitudinal and interventional study needed to develop a culturally sensitive rehabilitation strategies that restore intimacy, dignity, and holistic well-being. So sexual health isn't just about sex. It's about taking care of your whole body, mind, and spirit. These quotes beautifully sums up the hidden struggles we often overlook. That is, sexual health is about overall well-being, not just the act itself. Our survivors deserve that holistic care. So thank you very much.
Thank you, Dr.